recording, do feel free to do so, and I will send out this recording afterwards. All right. Well, welcome everyone. Thank you so much for joining our November BHAG meeting. If you'd believe it, we are almost here at the end of 2024. So I appreciate everyone setting aside some time today in your busy schedule to join us and to talk about a few things as we wrap up the year. We will start off today with a quick introduction. So if anyone would like to unmute and introduce themselves with your name, your organization, and we have a mindful minute prompt. Today it is, what holiday song or movie lifts your spirits?
I'll jump in. But the second part to your question, I still have to think about. But I'm Wayne Hart from Empower Minds Resource Center. And what song lifts my spirits? Just Merry Christmas, the original.
Very nice. Has anyone started watching any holiday movies or any festive songs out there? Amber said that she loves the original animated Grinch movie. White Christmas. Very nice. Well, for those who I've not met yet, my name is Taylor Palmer, and I work for the Prince George's County Health Department. So I am in the Office of Assessment and Planning, and one of my primary roles is helping to manage the our local health improvement coalition here in Prince George's County. So the Behavioral Health Advisory Group being one of our 4 work groups that I help manage. And I would say I am a sucker for just the good old Elf movie. Love Will Ferrell, so that one will always be on my watch list. All right, we got a few more here in the chat.
That will be playing for 24 hours. I think the beginning of December, just on TBS, I believe is the channel.
Awesome. I have to check that out.
And I'm Margaret Fowler, and I'm one of the co-chairs of the BHAG group, and Taylor keeps us straight. So, but mine is Miracle on 34th Street. I know it's an old one, but it is just always, I just love that movie.
And I see Faith put in the chat here that there are some new movies on Netflix. Faith, are there any that you recommend?
Hi everyone. I'm Faith, program director at Dyer. I saw one just recently, Christina and Milian, Meet Me at Christmas. It was good because I love musicals, and they had the a cappella team, Pentatonics, and that one, so it was really good. They had some really nice Christmas movies, Christmas songs in that, and I saw Hot Frosty. It's a new Netflix movie, so I saw that over the weekend.
I heard folks actually enjoyed it.
Yeah, it was magical.
Thank you for the recommendations. As you continue to get through them, please do let us know your review and what we need to check out.
Will do.
All right. Anyone else who would like to make an introduction today? Alrighty, well, thank you all very much. Feel free to add anything else that you would like captured in the notes. Feel free to add it to our chat today. All right, well, to jump into things, what we have planned today for you all is a discussion of our year-end objectives. So as you all know, each year our work groups set out with a very specific work plan of what they hope to achieve. And so we have a few updates for you all today of all of the BHAG's successes and some immediate next steps that we will be looking forward to in 2025. So just want to get some reactions from you all and make sure that we have captured all of our successes and see what else we need to add. And then we will go ahead and break for the our community announcements and upcoming meetings. Hopefully, we will keep things short and sweet for you all to get back to wrapping up a few things before we break for the holidays next week. All right, so just jumping right into things. So as I mentioned, we want to have this discussion with you all as our year-end review of the work group. So on taking place on Tuesday, December 10th from 6 to 7:30 p.m. in person at the Parks and Recreation Administration Building. The Prince George's Health Action Coalition, so that is the larger coalition that our 4 work groups are a part of, will be meeting in person to do their quarterly reviews. And so at this coalition meeting, being right here at the end of the year, we want to get to celebrate all of our work group successes and be able to update all of the co-chairs and all of the members who are in attendance of all of the wonderful work that you all do throughout the year. And this will be a really great time. Dr. Levy will be in attendance, and our other PGHAC co-chair, Dr. Little, will also be in attendance to hear all of the updates from all of our work groups about all of the amazing work that you all have done throughout the year. So I'm hoping that that will be a really great celebration to recognize you all for all of the time and all of the effort that you've given us throughout the year and continue to give us. And so with that being said, for each of our work groups, I'm putting together some content to share at that quarterly meeting. And so today I'll just go over really briefly with you all some updates to our goals and objectives, get some reactions from you all, and again, see what we're missing, and then hopefully put together something that encompasses all of your successes and be able to share that out at that quarterly meeting. I will also put in the chat the information for that quarterly meeting for anyone who wants to join. That is an open meeting. Please do feel free to join, to send it to your contacts. Again, it's just a really great convening to gather everyone and be able to share out the coalition updates and be able to plan for the new year. And so first, we have the BHAG set out to accomplish three goals throughout the year. Some of which you will see are more short-term goals and some are more long-term. So goal number 1 here, it's a almost middle of the road goal. So it's got some immediate things that were able to be accomplished, and then it's got some more long-term goals that we want to set out to accomplish. So this overarching goal of the BHAG is to promote upstream behavioral health care and prevent the onset of crises. So taking a look at our 2 objectives, objective 1.1 is to support a robust behavioral health continuum of care with behavioral health resources across Prince George's County. And so this came up as we were discussing the crisis continuum of care that we currently have in place, and that Faith is a part of, and Margaret and Carlos's team there at TLC Maryland, that they are leading efforts on. We wanted to be able to expand that continuum of care to take a look at gaps in the continuum to see what populations are we missing currently, what resources are there across Prince George's County, what are our assets, and again, the end goal being to be able to identify those gaps in the continuum. So to accomplish that objective, we set out to complete the BHAG partner survey. So many of you completed that survey right at the end of last year to, again, capture the expertise that we have within the work group. We then took that survey and we were able to plan out 12 collaborative partnerships to share organizational information and initiatives during our monthly convenings. So as you all know, whenever we gather you all for these monthly calls, we try to have an informative presentation that, again, increases awareness of existing resources across Prince George's County. It's time to be able to collaborate, again, time to talk about gaps in resources, any pain points, and so we can try to think together and troubleshoot and think about how we can best provide comprehensive behavioral health care to all Prince Georgians. And then lastly, our last strategy here, to identify gaps in behavioral health care and prevention efforts through a population health lens. And so this is a much larger strategy that will continue to shape as we continue to engage folks in the BHAG. So something that we are paying attention to. And again, as we identify those gaps in the behavioral health continuum, we'll be reaching out to those folks to invite them to the BHAG. So I encourage you all, if you all are looking around today and some of our usual partners are out at conferences and things, but if you're not seeing the folks in the room who need to be on this call, please feel free to extend invites to them to join the BHAG. Again, we want this to be as comprehensive as possible and to have representation for a multitude of services and populations served across Prince George's County. So please do feel free to extend this invite, or do let me know if those folks are missing and I can reach out to them and get them invited to these calls. And so to accomplish these objectives and strategies, the BHAG again had that partner survey that was used to again survey the resources and assets that we have here present in the Behavioral Health Advisory Group. Next steps include, with this partner survey, include recognizing all of our partners on the call today and who have been present within the BHAG. We want to highlight that information. We want to have that information on PGC Health Zone. So that is the webpage that the coalition primarily uses to highlight all of the great work taking place and all of the measures that we are tracking as it relates to the Community Health Improvement Plan. And so again, we want to be able to highlight the members using that partner survey who you all give us your time. So we want to be able to be sure that we're recognizing you. We'll also revisit that list in 2025 and take a look at any gaps in partners. And again, this will be an iterative process of making sure that those who need to be at the table are have a seat and always feel welcome to share their thoughts in any programs or, again, any gap areas that the BHAG can support. And so taking a look at strategy 1.1.2 with this collaborative partnerships goal, we were very successful in meeting our mark for this strategy. We welcomed several partners from many different organizations. You all were very gracious with your time, so I thank everyone who came and presented to the BHAG, who shared about initiatives. We were able to again have just such a wide gambit, a wide variety across the continuum of care, those presentations. So I thank you all for coming to present this year, and certainly hope to continue to interact with you all and see you all in 2025. Any questions or any comments, any successes that I didn't track here for goal number 1? All right, and this, we will see these slides again. We will bring it up in the new year to again take a look at what we need to revisit and what we need to continue working on. But just wanted to share this with you all again as we approach the end of the year and wanting to highlight this information at the coalition meeting. Next, as we look to objective 1.2, to engage with state initiatives to expand access to comprehensive behavioral health services for adolescents. So this was specifically accomplished through our interactions with the Maryland Consortium on Coordinated Community Supports. So a major victory, 19 spokes were awarded across Prince George's County from the consortium to address youth mental health here in Prince George's County. So a very exciting success and something that we are continuing to track and hear from those grantees, again, about the programs that they're offering, the data that they are collecting, and then any points where we could connect and see how we can best support those folks. And again, building a more comprehensive model to address the youth behavioral health crisis here in Prince George's County. So again, we met we met our goal here to be able to facilitate those 2 meetings with representatives from the consortium, and then also our ongoing efforts to be able to engage those spokes in our meetings. So all 19 spokes were invited to these calls, and we've had representation from a few spokes to come out, but we will be again reaching out to folks more in 2025 to invite them to come to our BHAG meetings, to be an active participant and be able to share about the great work that they are doing as it relates to youth behavioral health services. Any questions or reactions to this slide? All right. And so this slide, I apologize for throwing a lot of information at you, but this is just a summary of some of our next steps and some things that we will be tracking as we go into 2025. So again, as I mentioned, trying to support a robust behavioral health continuum of care that includes all of our partnerships, recognizing our current partnerships, identifying gaps, and again, just making sure that we are getting those folks to the table. And we are, again, just encouraging folks to share information and be able to break some silos. And then, as I just went over there, engaging with state initiatives to expand access to comprehensive behavioral health services. So again, additional engagement with the consortium as if they were to release more funding opportunities, and then also engaging with the Maryland Department of Health to discuss implementation of some of their initiatives that were outlined in the State Health Improvement Plan. So those presentations will hopefully be coming in 2025. We'll keep everyone updated with some of those access points for us to discuss and possibly be engaged in. Next, jumping to goal number 2, which is to integrate programs and services in the continuum of care for high-risk individuals and their social support networks. This has been an ongoing commitment of the BHAG that predates my joining of the BHAG with the health department, and something that the group has remained committed to is justice-involved individuals. So wanting to uplift that here. And objective 2.1 is to identify and engage Prince George's County resources and stakeholders from the criminal justice system to disseminate and improve access to resources and services. And so across 2024, we have met this goal in our engagement with the Prince George's County Department of Corrections, Bridge Center at Adams House, in the Maryland Returning Citizens Affairs Division. So this remains a leading commitment of the BHAG, but we will continue to have the discussions, hear from those resources. You're seeing a few folks are out today. They are actually, I've heard from a few partners that they are currently attending the National Conference on Youth Justice, hosted by the Office of Justice Programs, Office of Juvenile Justice and Delinquency Prevention. So again, just affirms the commitment to justice-involved individuals and talking through access points in the continuum of care to be able to expand resources to support those populations. So we will hopefully hear from more partners in 2025 and hear about the initiatives for justice-involved individuals. Any reactions or any questions to goal number 2? All right, and then here we are at the our long-term goal number 3, which is to destigmatize the utilization of behavioral health services. That involves objective 3.1, which is to advocate for behavioral health screenings for physical somatic health practitioners to use during annual wellness visits with patients. And so our strategies here include collecting baseline data on behavioral health screenings, conducting environmental scans of evidence-based screening tools, identifying screening tools for BHAG members to promote, and then lastly, developing the messaging to engage partners to promote these screenings to primary care providers. So again, this is a very, very large goal that we will continue to break down through these strategies. But so far, we have engaged with Dr. Blunt. She did a presentation on State Bill 0108, which requires health insurers to provide coverage and certain reimbursement for annual behavioral health wellness visits. I'm sure she will have some more updates as we enter this next season, this next policy season. So I will keep you all updated with that information for anyone who is interested in that advocacy work. And then also our ongoing partnership with the Prince George's County Health Department's Behavioral Health Division. We heard from Brittany Vasquez earlier this year about the two SAMHSA grants that had some overlapping efforts with this goal. And we've also connected recently with Denise Albright, who is on the call today. And so we will be coordinating efforts to see again how the BHAG can support ongoing efforts of the Health Department's Behavioral Health Division, and to see if there are specific things that that the work group can advocate for and help our partners to uplift. So we will continue to track this larger long-term goal. But of course, if anyone has any additional information that they would like to share or would like to connect to additional resources, please do let us know. Any questions or reactions to our goal number 3? All right, well, thank you very much for letting me get through that information. So like I said, I just wanted to give some very brief updates and again, ground all of the wonderful work that you all are doing back to that work plan that we originally set out to accomplish. So I will take all of this information and create some sort of digital material that highlights all of this information to be presented to the Coalition's quarterly meeting on December 10th. Denise, I see your comment there in the chat. It is taking place from 6 to 7:30 p.m. We will be providing a meal during that meeting, so please, again, feel free to join us on December 10th. We would love to have you. Would love to, again, be able to share work group updates and just get to celebrate you all for all of the hard work that you have given the work groups and look forward to 2025 with you all. And so to do so, to put together that material, I want to be sure that I am again highlighting all of the organizations who are a part of the BHAG. So by December 4th, if you could please email me with the preferred name and logo of your organization and the name of any members from your organization who are active in the BHAG, who you would want listed again on that material, recognizing the BHAG's efforts, the successes of 2024. So please send me that information so I can include you and make sure that you are represented in our list. If you are a community member who are joining us, please feel free to let me know and indicate that you would like to be recognized as a community member. I know some folks like to be recognized under the umbrella of their organization, while some would rather be recognized as a proud Prince Georgian. So please do feel free to let me know if that is the case, and we will get you addressed in that information as so. Please also send me any achievements or any proud BHAG moments that you have from 2024. Would love to highlight that information again as we're creating this year-end product. Would love to hear from you all about what stood out from this year or what we can improve on. So please do feel free to send that information over to my email and we will get it included. Any questions about our next steps? And I will include these slides in the meeting notes and all of our next steps as well. All right. Well, we will next jump into our community announcements. I'm going to pop a few announcements here in the chat. And as you guys will see at bullet point number 5 here is where you can register for the in-person PGHAC quarterly coalition meeting taking place again on Tuesday, December 10th from 6 to 7:30 p.m. So first, I included the link to the Maryland Department of Health, their interactive dashboard. They have recently put up their cannabis data. So some interesting trends that you can take a look at. You can take a look specific to Prince George's County. You can take a look at specific age groups, race groups. You can look at it by sex or geography. So some really interesting data that's presented, and you can take a look at the trends as well. So this is hot off the press, just came out a few days ago. Wanted to link folks to it. It also has some overdose data, some biosurveillance data, firearm violence, and women's health data that is coming soon. Next, coming from our friends over at the Integrated Maternal Health Services Initiative, they have the Patient Family Caregiver Advisory Group, and they are hosting interviews. They are hoping to interview pregnant or recently pregnant participants. So by recently pregnant, they want folks who were pregnant within the last year. So folks will receive a $100 an hour stipend for that interview. And folks are also invited to participate in the quarterly advisory group meetings. So if anyone is interested, I have put Grace's contact information in the chat, and I will put that in our notes as well. So you can email Grace with any questions that you may have, or if you know anyone who is interested in participating, feel free, please do send this to your networks. I will send out this flyer as well as the flyer translated to Spanish. I will include those flyers in the meeting notes as well to share with your networks. Next, I linked our community health community input survey. So the community input survey is a very important component of the community health assessment. And we are finishing up the development of that survey, and we wanted to share it with you all to get your feedback. Again, as content experts in many different fields, we want you all to take a look at it and see if it includes the questions that you would want asked in this input survey. Again, this is a very important component of the community health assessment, and we want to make sure that the community health assessment is measuring things that you believe are relevant to Prince George's County. So if you all could take a look at that survey, and if you have any edits, please feel free to email those edits to me. I put my email in the chat, and I will also include it in the meeting notes. But if folks have any feedback, please provide that by Wednesday, December 4th. And just as two pieces of helpful information, hopefully. The survey was informed by the 2022 Community Input Survey, as well as the Maryland Department of Health's Community Input Survey for their State Health Improvement Plan. And the audience of focus for this survey specifically is anyone who lives, works, plays, or worships in Prince George's County. And we will only have the survey offered online. So that is just something to consider in any questions that you may be considering or any edits that you may have. And please also, I included a link to this survey. We are starting to think about how we're going to get this survey out. And we want to make sure it reaches as many Prince Georgians as possible. So if you could, there's a Google form that is linked in the chat, and I will also include it in the meeting notes. If you could include any organizations that we need to reach out to with the survey to reach community members, please provide that information. Again, we want to make sure we are reaching as many folks as possible, that we are not missing anyone. So if you can provide any of your partners' contacts, we would greatly appreciate that. And then lastly, as I have mentioned several times, throughout this call, the quarterly coalition meeting that is taking place coming up in a few weeks at the Parks and Recreation Administration building. It'll be from 6 to 7:30 p.m. Again, we'll be sharing those work group updates. If you would like to come, please do join us, send it to any of your networks, and you can use this QR code, and I will also include a link in the meeting notes to register for the event. Please register for the meeting so you can reserve your dinner of choice. And does anyone have any community announcements that they would like to share? Denise?
Hi, thanks so much, Taylor. This is all really great information. There is another survey that the Maryland Department of Health is conducting as well, and it's the Maryland State Young Adult Survey on Alcohol. They're trying to assess at the jurisdictional level a few responses from us as well as our community partners, et cetera. And so we want to make sure that we have good data that represents us in Prince George's County. And so if it's okay, I'll put the link to that survey in the chat. And hopefully, if you're able to, in terms of all the partners here, if you're able to support, we certainly would appreciate it. Thanks.
Thank you, Denise. Any additional upcoming events or any community announcements? Alrighty, well, I have put my contact information here in the chat, so feel free. Again, let me know if you all need anything in the meantime, but we will convene as the BHAG on Wednesday, December 18th. But I certainly hope to see you all before then. If you're available to attend the in-person coalition meeting, would love to see you in person and get to celebrate you. But we will otherwise see you on Wednesday, December 18th. Margaret, any closing words?
Just thank you for all the work everybody's done. We can't do it alone. It takes a whole entire team. So just thank you. And thank you, Taylor, for always being there to help coordinate all these meetings. Truly appreciated.
Thank you, Margaret. All right. Well, if anyone doesn't have anything else, thank you all again for joining us. Thank you all for all your hard work throughout the year. Take a well-earned break, and we will see you next month.
Thank you.
Take care.
Bye-bye.
All right. Bye-bye.